I first realized I wanted to be a nurse when I had my first son. It wasn't necessarily a wonderful experience, and it had to do with the nurse who cared for us and how she treated myself and my family. And I realized that it could make an incredible difference if the nursing care was compassionate and centered around my needs and my family's needs as opposed to their needs. Here in Seattle, we have a large Somali population, about 30,000. They're very resilient for what they've gone through. Many came through refugee camps, and that's one of the populations that has been something that we've had concern about because we know that they're underserved, that they've been through a lot.
I was taking care of a Somali woman, and there were some things going on in her labor that were not real safe, and at the time she declined medication. It was very clear that they didn't trust us as healthcare providers. So I thought to myself, what can we do to help foster trust and relationships with people that you see in a very highly emotional, stressful time of labor when you've never ever met them before?
We came here to work hard and to get a better life and to help the people back home. I work 5 nights and I support my family back home. I send them money so my sisters and brothers could go to school.
We reached out to the community as a whole and asked them what they knew about the Somali population and what the women might need. We found that we really didn't have a clear understanding of the culture and all of the historical things that impact how they view Western medicine and how they view the care that they receive. We realized we need to go directly to the women so we can hear what they need.
In the Somali Health Board, we did decide to form a focus group or like a community gathering. I knew there was so much that the women wanted to talk about, but I wasn't sure what to expect.
One of the loudest voices we heard from the Somali women was that the way that we provided education to them in the clinics was not culturally relevant to them. It wasn't meeting their needs, and they didn't value it as much as we would have hoped.
It's a lot of work to be a mother, especially when you don't understand the language, the system, the environment. If they go to that center, they can speak to someone who speaks their language.
Being an oral community at the Somali women, we like to share stories and talk around vital issues when it comes to women. I think the centering would be great for the Somali women. It's a social setting. We can come together as pregnant women. They could be a woman who might have had 3 children, but is there at the centering concept because she has some background stories or history or something that she can share with a first-time pregnant woman.
It's been a wonderful experience learning about how important relationship is, how important it is to listen. I think that's one of the most important things that healthcare providers can do. Just stop and pay attention and ask, what is it that we can do to help? And that, to me, has been the most important lesson that I've learned.
We were at a perinatal forum, and one of the Somali moms said to us that we were honorary Somali sisters now. The fact that we could bridge some of the gaps that we've experienced was incredible, because I really think it is making relationships and trust and establishing that we really are looking for the same thing, which is healthy moms and healthy babies.
It's all coming together, and it's so rewarding that changes are starting to happen. We had a lot to learn both ways, and it's just been an amazing ride.